You know that nagging cough you've had for weeks? The one you keep brushing off as allergies? Or maybe it's that unexplained weight loss your friends are complimenting you on, but deep down, something feels off. Here's the thing most people don't realize. Some of the earliest signs of cancer look completely harmless. They blend into everyday life so seamlessly that we dismiss them without a second thought. Today, we're going to cut through the noise and the fear to give you clear, practical information about what your body might be trying to tell you. This isn't about scaring you. It's about empowering you with knowledge that could genuinely save your life. Let's start with why this even matters. Early detection of cancer is one of the most powerful tools we have in modern medicine. When cancer is caught early, before it spreads, treatment options expand dramatically and survival rates skyrocket. We're talking about differences that can be measured in decades of life. But here's what I need you to understand right from the start. Having symptoms doesn't mean you have cancer. In fact, most of the time, these symptoms have completely benign explanations. Your persistent cough might genuinely be allergies. That fatigue could be stress or poor sleep. The goal here isn't to turn you into a hypochondriac who panics at every sneeze. The goal is to help you recognize patterns and changes in your body that deserve professional attention. Think of it as becoming fluent in your body's language, so you know when it's just having a bad day versus when it's sending up a legitimate red flag. Let's dive into some of the most common early warning signs, starting with unexplained changes to your body. Sudden weight loss might sound like a dream come true in a world obsessed with dieting, but if you're dropping pounds without trying, without changing what you eat or how much you move, that's worth investigating. We're not talking about a couple of pounds here and there. We're talking about losing 10 pounds or more without any clear reason. This can happen with several types of cancer, particularly those affecting the pancreas, stomach, esophagus, or lungs. Then there's persistent fatigue, and I don't mean the tiredness you feel after a long day at work or a poor night's sleep. This is the kind of exhaustion that doesn't improve with rest, the feeling that your batteries never fully recharge no matter how much you sleep. It's the fatigue that makes normal activities feel overwhelming. Cancer-related fatigue happens because the disease can change how your body uses energy, or because some cancers cause blood loss that leads to anemia. Now let's talk about pain and discomfort that just won't quit. Headaches happen to everyone, but a headache that persists, that doesn't respond to normal pain relievers, or that comes with other symptoms like vision changes or nausea, that's different. Similarly, ongoing chest pain or discomfort in your abdomen that sticks around for weeks deserves attention. Most pain is temporary and has obvious causes. You pulled a muscle, you ate something that disagreed with you, you're stressed, and it's manifesting physically. But pain that becomes your constant companion, especially if it's gradually getting worse, is your body's way of insisting that something needs to be checked out. Pain is subjective and personal, so trust your instincts here. You know what normal feels like for your body. Visible changes are often the signs people notice first because we can literally see them. Changes in your skin are particularly important to monitor. This includes new moles or changes to existing ones. Remember the ABCD rule: asymmetry, border irregularity, color variation, diameter larger than a pencil eraser, and evolution or change over time. But skin changes aren't just about moles. Yellowing of the skin or eyes, called jaundice, can indicate liver or pancreatic issues. Persistent redness, scaling, or sores that don't heal also warrant evaluation. Lumps or swelling anywhere on your body should be checked, especially if they're growing or if they appear in areas like your breasts, testicles, lymph nodes in your neck, armpits, or groin, or in soft tissue anywhere in your body. Most lumps aren't cancer. They're often cysts, benign tumors, or swollen lymph nodes fighting off an infection, but they need to be properly evaluated. Internal symptoms can be trickier because we can't see them directly, but they're just as important. A chronic cough that lasts more than a few weeks, especially if you're not sick with a cold or respiratory infection, needs attention. If you're coughing up blood, even a small amount, see a doctor immediately. Changes in your bowel or bladder habits that persist are also significant. This might mean constipation or diarrhea that doesn't resolve, changes in stool appearance, blood in your stool or urine, needing to urinate more frequently, or difficulty with bladder control.
Difficulty swallowing, persistent indigestion, or ongoing nausea and vomiting. These digestive symptoms that stick around are your body asking for help. Here's where it gets really interesting. There are symptoms people commonly ignore because they seem too minor or too ordinary to matter. Persistent hoarseness or changes in your voice that last more than a couple of weeks can indicate throat or laryngeal issues. Unusual bleeding or discharge should never be ignored, whether it's between periods, after menopause, from the rectum, or in your urine. A fever that comes and goes without an obvious infection, night sweats that soak your sheets, or persistent itching without a visible rash. These vague symptoms often get dismissed as stress or getting older, but they can be early signs that something's wrong. We tend to normalize things that become routine. If you've been tired for months, it starts to feel normal. If that little ache has been there so long you've stopped noticing it, your baseline shifts. But normal doesn't mean fine. Sometimes what we've learned to live with is exactly what we need to investigate. So when should you actually see a doctor? Here's a practical guideline. Any symptom that persists for more than 2 to 3 weeks without improvement deserves professional evaluation. If symptoms are getting progressively worse, don't wait the full 3 weeks. If you're experiencing multiple symptoms simultaneously, especially if they seem related, that's another trigger to seek care sooner. And if something just feels wrong, if your gut is telling you that this isn't normal for your body, listen to that instinct. You're not wasting anyone's time by getting symptoms checked out. Doctors would much rather evaluate something that turns out to be benign than have you wait until a serious condition has progressed. Remember, early detection is the goal here, and you can't detect anything early if you don't speak up about what you're experiencing. Now, let's shift gears to something hopeful, because while we're talking about cancer symptoms, we also need to talk about prevention and risk reduction. You have more control here than you might think. Basic lifestyle choices make a real difference. Don't smoke, and if you do, get help quitting. Limit alcohol consumption. Maintain a healthy weight through balanced nutrition and regular physical activity. Protect your skin from excessive sun exposure. These aren't empty platitudes, they're evidence-based strategies that reduce cancer risk across multiple types. Beyond lifestyle, screenings are crucial. Mammograms, colonoscopies, Pap tests, PSA tests, these aren't fun, but they catch cancer at its most treatable stages. Follow the screening guidelines for your age and risk factors. If you have a family history of certain cancers, talk to your doctor about whether you need earlier or more frequent screening. Let me bring this all together for you. Awareness of cancer symptoms isn't about living in fear or seeing cancer everywhere you look. It's about being an informed, proactive participant in your own healthcare. It's about recognizing that your body communicates with you, and sometimes those communications are worth taking seriously. Early action, consulting with healthcare professionals when something doesn't feel right, asking questions, advocating for yourself. This is how you give yourself the best possible outcomes. Stay informed, but stay balanced. Not every symptom is cancer, but every persistent or concerning symptom deserves attention. You deserve to feel heard, to have your concerns taken seriously, and to get the care you need when you need it. If this video helped clarify things for you, if it gave you information you can actually use, do me a favor and hit that subscribe button. Share this with someone who might need to hear it, and drop a comment below telling me what health topics you'd like to see covered next. Your health matters, and knowing what to look for is the first step in protecting it.